1 in 5 North Dakotans have been tested for COVID-19. That's more than 150,000 tests to date. If you are going to be tested, the experts are finding that the type of test matters. Valley News Team's Katie Opperly takes a look at what's being offered in the Cass County area and how effective these tests are.
Healthcare providers have been rapidly testing people for COVID-19, hoping to get a better handle on the pandemic.
Usually it's a nasal swab or a throat swab. Some of the newer ones have saliva, where you just get upper respiratory secretions.
These types of tests have all been used at Essentia in Fargo, and not all tests are equal.
The data that I've seen shows that the nasal swabs can be off by as many as 30% of the time, or about a third of the time. Pharyngeal swabs, similar, where the nasopharyngeal ones might only miss it 10 to 20% of the time.
Vetter explains the nasopharyngeal, or the long swab that enters the nose and to the throat, is the most likely to detect the virus, because the further you get away from the respiratory tract, there is more room for air.
The nasopharyngeal and the nasal swabs are the two most common right now.
At Samford, they say nasopharyngeal is the only test they are using, adding they have had very few false positives or negatives. But Vetter also stresses if you're looking for the most accurate result, timing matters too.
If you do it a few days before you have symptoms or a week or more after symptoms, the test isn't going to be as reliable or as accurate.
Health experts say new technology and studies are surfacing every day as the pandemic continues to impact the nation, working to find the most effective way to detect and combat the virus. In Fargo, Katie Opperly, Valley News Live.
Experts also say there have been a lot of questions about antibody testing. That uses blood to see if you have immune response to COVID-19 and tells if you've had a previous infection. But it does not tell you if you currently have the virus.
North Dakota's governor